Hello, everyone. Today I will be talking about Alzheimer's disease and creating an evidence based exercise prescription for individuals living with this condition. So, what is Alzheimer's disease? Alzheimer's disease is a progressive neurodivergent disorder that causes memory loss, difficulty thinking, and changes in behavior. Disease is associated with the buildup of beta amyloid plaques and tau protein tangles in the brain. These changes lead to damage and death of nerve cells, especially in areas related to memory and executive function, like the hippocampus. Over time, this results in significant cognitive and functional decline. So, about the epidemiology and prevalence of Alzheimer's, about 6.7 million adults age 65 and older in the United States are currently living with Alzheimer's. And this number is expected to double by 2050 because of population aging. Women are nearly twice as likely to develop the disease compared to men. Alzheimer's is also the fifth leading cause of death in older adults. This just shows how critical long-term functional support and exercise interventions are for this population. So, what are some of the common symptoms with Alzheimer's? In the early stages, individuals may have mild memory difficulties and trouble organizing daily tasks. Um, During those middle stages, the moderate stages, the confusion will increase, communication becomes more difficult for them, and personality or emotional changes may appear. In the late stages, individuals require full assistance with all daily activities and may even lose the ability to walk, speak, or swallow. And these symptoms progress gradually but consistently over time. So, what is the impact on exercise response in this population? Those with Alzheimer's commonly demonstrate slower gait speed, shorter step length, and balance instability. These factors increase fall risk and make mobility less efficient. Gait and balance difficulties are strongly associated with decreased ability to perform daily living activities. So, this means our exercise plan should include balance and gait training, not just aerobic and resistance training. So, what are the benefits of exercise on this population? So, exercise has been shown to improve mood, sleep, and cognitive processing in individuals with Alzheimer's. Research also shows that aerobic exercise can increase hippocampal volume, which supports memory and learning. Exercise also improves gait stability and balance, which helps reduce fall risk and just helps them maintain independence longer. It also helps reduce the caregiver's stress, as if their patient maintains more independence, they are liberated of some duties that may become more stressful, especially in those later stages. So, of course, Alzheimer's has some medications that are associated with it. You have things such as selective serotonin reuptake inhibitors, or SSRIs. These are essentially antidepressants, and it's used for mood regulation. Some exercise considerations, however, is that they may cause fatigue and dizziness, so it's important to always monitor the patient's symptoms throughout exercise. We also have cholinesterase inhibitors, such as donepezil, which may lower heart rate, so it's important to monitor heart rate as well during exercise. We also have memantine, which can help reduce agitation, which actually could help improve exercise participation and adherence. For all medications, it's very, very important to monitor safety and hydration and alertness of the patient, just to keep them safe and healthy. So now we can move on to an evidence-based case study. We're going to be working with a 71-year-old woman with stage 2 Alzheimer's. She has a history of controlled hypertension and anxiety. So her goals include preserving her cognitive function, maintaining her cardiovascular fitness, and reducing her anxiety while always staying socially active. Um, she will benefit from simple instructions in low stress environments, and as well as a consistent weekly routine, which is very common in this population. Um, so, because of this, I think a guided walking group or a small exercise class is going to be an ideal format for her. So first we would begin with our assessments. So for her aerobic capacity, we'd use a 6-minute walk test. Then for the lower body strength, we'd probably use the 30-second chair stand test. Next, we'd move on to balance and get a gauge of her overall balance and assess her fall risk as well. And we'd use the timed up and go test. From there, we test her cognitive motor function using a dual task walking test that would help with just real world kind of challenges. We'd finish off with a flexibility test by using the chair, sit, and reach test just to get a gauge on how mobile and flexible she is. So for her aerobic exercise prescription, we would begin with 3 to 5 days per week. Trying to definitely starting at 3, trying to move to 5. As for the intensity, we'd only be working around 40 to 60% of her heart rate reserve, or at about an RPE of 9 to 12. The time would be starting out at 20, trying to work up to 40 minutes total. Always kind of or better to break it down into intervals as well, just to make it easier for her to kind of maintain the right work rate. We'd probably focus on more lower intensity movements or actions like walking, cycling, aquatic exercises in a pool, or group workouts like a walking group. The progression would be focused heavily on just a gradual increase in time before increasing the intensity. As for her resistance training, I would have her do about 2 to 3 days per week at, again, about a 40 to 60% of her 1 rep max, or at about an RP of 5 to 7. We'd work with about 1 to 3 sets depending on the movement at about 8 to 12 repetitions. We'd focus on functional movements like sit to stand, step ups, carrying movements such as those, and just movements that would directly translate to her daily life. So as for balance and neuromotor function, uh, I would try to do 2 to 3 days per week of these movements or activities, and we'd be practicing gait speed, obstacle stepping, tandem stance, and just dual task walking, so like walking and talking, things like that. Um, Keeping it within a safe kind of mode. These activities would help improve mobility and reduce her fall risk and just make her everyday life easier. This is important because of, as I previously mentioned, uh, gait and balance decline are highly related to loss of independence. Moving on to flexibility. We'd start out about 3 days per week, try to get her up to maybe doing some at least light stretching every day of the week. We just do static holds, 30 to 60 seconds, kind of working around the entire body, getting all major muscle groups involved. We would definitely use a chair supported stretching technique just to improve safety and keep her consistent within her movements. Some possible modifications and precautions for this population in general, but especially in my case, would be using one-step instructions just to kind of keep the instructions clear, so no multi-step instructions. Demonstrating everything visually, and me having the client or patient mirror my movements just to make it as simplified for them as possible and very obvious of what the task is. I would maintain a consistent environment and routine, so trying to do the same times and days, similar setup for the classes and stuff like that, and in the equipment we use, and minimize any kind of distractions and avoiding loud or crowded settings. And then of course just supervising all movements, all exercises, just to reduce any kind of wandering or possible fall risk. Overall, exercise does not cure Alzheimer's, but it does play a significant role in slowing functional decline. Um, it helps maintain independence, reduce fall risks, and improves overall quality of life for the anyone in with Alzheimer's disease, as well as their caregivers, because as their independence improves, the caregiver's tasks can go down a little bit and help them focus on less things and give better quality care. Um, but overall, the goal is to keep individuals active, engaged, and just safe for as long as possible, and hopefully keep them happy as well.